Just give me a thumbs up if you can hear me properly. Hi friends, good morning. Good to have you. Hi friends. So yeah, I think I'm live. So welcome to today's session. Today we'll be talking about how to approach general surgery for NEET PG 2021 and AIMS and PGI session part 1. Okay, so right. Hi. Good morning guys. Good morning everyone. Good morning Surya. Good morning A1. Have you with us? Let me just check whether I'm live. Hi. Just give me a thumbs up guys. Good to have you. Right. Just give me a couple of seconds. I'll just settle down and yeah, we'll be talking about this. So today is basically our just a simple talk in which we'll be okay. Right. So let's move on and let us talk about today's thing. Okay. So hi everyone. Uh, right. Good to have you all. So today we'll be talking about how to approach general surgery for the NEET PG 2021 and right for the AIMS and May PGI session part 1. Okay, so let us begin by talking about today's particular thing. Right, so if you have any doubts, please feel free to comment on the chat box and I'll be addressing all your questions. If at all you have, I'll be addressing them. If not, let's move on and let's talk about what are my views on it, and then you can think over it and you can adopt if at all you find them useful. Okay, so first and foremost is, as I have told you, I will basically be talking about how you should approach the NEET PG 2021 as well as the AIMS and PGI. So first and foremost, let me talk about who are the candidates who should definitely try their best to get for the mid-year exams. So who are the candidates who should definitely aim for the mid-year exams? So see, understand, once the NEET PG results come out, you will be falling either into one of the categories. First, you will be getting a really good rank within 1,000 or so, and you'll be really happy with your results, so no need to prepare for any of the exams. Now, the second category of the students include two types of students: those who have got a average rank, let's say between 2,000 to 5,000 or something, and those who have got a rank close to 8-10,000. Now, if at all a person has got a rank between 2 to 5,000, he will definitely get a seat. But if at all he or she is not happy with their performance and they want to sit back and study, and those who have just missed getting a rank, let's say they have got a rank of 8,000, 9,000 or 10,000 something. Just give me 1 minute guys, I'll be just back. Just give me 1 minute. I'm really, really sorry for the interruption, guys. I'm really apologizing for this. Yeah, right. So where I was talking about the types of students. So let's assume that if at all somebody has got a rank of between 2 to 5,000 and he or she is not happy with the performance, if they want to wait for a better seat or for a better college or for the central institutes, or if you have just missed a rank, let's say in around 8-10,000 or something, these are the kind of students who should definitely target the mid-year exams. Now, if at all a student falls into the category whether he has got a rank of 25, 30,000, 35,000 or something, then the coming 3 or 4 months are really not adequate to attempt for the mid-year exams very, very seriously. They should definitely give the mid-year exams, no doubt about it, but they should not aim for this. Because what will happen if at all they don't get selected in the mid-year exams, they will again be in there will be a lack of strategy after the mid-year exams, and they will not be able to focus on the NEET 2021 or the November sessions very, very nicely. So the first point is, if at all you are a kind of student who has got an average rank in the, like, not an average rank, a good rank, but if you're not satisfied with your performance, or you have just missed the NEET PG by a couple of thousand ranks, you should definitely aim for the mid-year exams. You have a very, very good chance to prepare for it. The only reason I'm not saying that a student who has got close to 25-30K should aim for the mid-year exams primarily. The only reason I'm saying that because the lack of time, because you have only 3 months remaining, and if you put in your best also, you might not get a rank which will fetch you a really good seat. So rather than this, prepare for the November or the kind of NEET 2021. That is a better thing. Now, how should you read general surgery? So this is about who should be preparing for the mid-year exams, right? So let's talk about the next thing, that is how should you read general surgery. So how you should read general surgery? See, understand the basic formula about reading anything or approaching anything is given to us by the Will Smith. Let us read what the Will Smith is trying to tell us. So he basically says that if at all you want to build up a really good wall, for example, in this particular case, cracking the NEET PG, a very good thing. So if at all you want to build a really good wall, you don't set out by building a wall. Set out to build a wall. You don't say that I am going to build the biggest, baddest, greatest wall that's ever been built. You don't start there. You say I'm going to lay this brick perfectly as a brick can be laid, and you do that every single day, and soon you have a wall. So what Will Smith is trying to make us understand is that if at all you want to achieve something which is very big, which is a bit difficult to achieve, but it is very much possible to achieve, you know that you have the capabilities to achieve that, you don't start out by saying that I'm going to do the best thing ever, like best thing ever whoever has done in this world. You don't start out there. You start out by concentrating on the thing which is in front of you. You concentrate on doing the things right today, and you do things right every day till that particular day comes, and ultimately you will be doing very good in this particular exam. So the same ideology applies for even the NEET PG students. See what will happen once the results will come out. Some of your friends would have got a really good rank, maybe some of your seniors would have got a really good rank, and you will be all enthusiastic. You will start your preparation with the whole zeal, and you will feel that okay, I will read so well that I'll get a rank within 100 or so. Don't try to do that. Just try to give your 100% to every day. If at all you give your 100% every day till your exams, let it be a May exam, let it be a NEET 2021, whatever you are eyeing at, you will definitely, your probability of getting success in these particular exams will definitely increase very drastically. So this is a thing which you should understand, right? So okay, so this is a thing which I wanted to tell you. Now the next slide which is there, this is basically the basic format of reading for general surgery. Before targeting this, let me take a question. So Surya is asking, how many months required for the NEET PG 2021 for a good rank? See, understand, we will be talking about it. So it's really not about how many months are required. It is about how much dedication do you put in. So close to 6 to 8 months of reading, it is definitely needed for any exam if you want to get up a really good rank. So yeah, at least around 8 months of good reading, at least this much is definitely needed to get a good rank in some of the exams, right? Now I'll be talking about how you should read. So in this particular slide we will be talking about how to manage time and how to read or something like that. But first let us see how to approach general surgery. Now many students have a problem with general surgery. They say that general surgery is really vast and they are not able to read it, they are not able to remember it. They read it so many times but still they are not able to remember it. Okay, so please understand one thing, whenever you read general surgery you should follow these basic rules. So divide each topic into the smaller topics. So for example, you obviously do that. Okay, so if at all you are planning to read a esophagus, so you divide esophagus into the clinical anatomy of the esophagus, then you divide it into GERD, then you divide it into achalasia cardia. So you divide the big topic into small topics. So again, the same thing, not try to read esophagus like to the best of your capabilities. Try to master the smaller topics in the esophagus, and soon you will be reading or you will be mastering the esophagus in detail. So this is something which you have to do. Now another important thing which I always tell is try to correlate it with the story and try to understand the pathogenesis of the disease. Now you must have felt it in the NEET 2020, there were many clinical scenario based questions. So if at all you are the kind of person who basically forms the story behind you, for example, if I tell you renal cell carcinoma and in your mind there is a story. What do you mean by story? Story is basically the sequence of events or the clinical features or the pathogenesis which occurs in that particular disease, and that comes in front of you step by step. So if at all you have understood that particular disease in such a manner, you will be definitely be able to answer what is the next step in the management of the patient, what is the next investigation you will do, what is the best step, depending upon this particular clinical scenario, what is the next line of treatment. So for these particular things, you will have to understand the pathogenesis of a disease in a crystal clear manner. And you will have to correlate it as the patient comes to you, and what exactly you do in the patients, you have to correlate with that. I'll talk to you how do you do that, but just understand. So okay, so how do you do that? See, understand. So if at all you have any topic, okay, so let's assume you have a topic of right. So let's assume that you have a okay, so let's assume that you have a topic of, let's say, achalasia cardia. Okay, so the basic things which you need to follow in any particular topic is, the first thing which you should understand is, what is it? So what do you understand by what is it? See, if at all, if you have a topic, if at all you have any particular disease, you should understand in a crystal clear manner in order to make a lay person understand. For example, if you are able to make a non-medico understand what exactly is this is a point when you have actually understood the disease. So rather than just remembering, okay, achalasia cardia is a condition of the esophagus which occurs because of the absence of the ganglion cells and other things, rather than this, you have to actually understand what exactly that disease pathogenesis is. Okay, so if you are able to make a lay person or maybe a 5-year-old or a non-medico understand what exactly happens in this disease, this is a point when you have actually understood what actually happens in this disease. So first thing, you have to know this. The second thing is, what about the clinical features? So how you should remember, okay, so once you know what this particular disease is, and this also includes the cause, so you should be able to tell why is this disease happening. Okay, so what is the cause behind this particular disease? Then the second thing is the clinical features. So what do you understand by the clinical features? How do the patient presents to you? So again, this has to be this should come to you in the form of a story. For example, achalasia cardia. So if you know that this is a cause and the patient comes to you with dysphagia, and because of the dysphagia the food starts accumulating, it comes to the larynx, patients develop laryngitis, and there is a dental caries will occur because of the reflux of the acid again and again into the mouth, and if at all it drains into the lungs, patient will develop pneumonitis and ultimately lung abscess. So if you know this particular sequence, you will not be there is no need of memorizing all the clinical features. So take up any disease, you should be able to tell how do the patients presents. Okay, so what will be the first symptom and how the disease will progress if at all the adequate treatment is not taken. This is something which you should do. So this again will help you in the clinical scenarios. The second thing is the diagnosis. So in the diagnosis, what you have to know is, what is the first step in the management of the patient, what is the best step in the management of the patient, and depending on the clinical scenario, what is the next step which you will go for. So this will vary from disease to disease, but whatever the disease might be, you have to understand that what will be the first initial step in order to reach closer to the diagnosis, and what is a particular step which gives you the definitive diagnosis. In some of the diseases, both of these will be same. In some of the diseases, there will be a controversy, but you have to understand, you have to debate inside your mind on these particular topic. Okay, so please understand, this is how you should understand how do you diagnose a particular condition. Okay, right. And then what happens, this is about the diagnosis, that's fine. And then what? So this is what is the disease, what is the clinical features, how do you diagnose it, and then if at all you don't treat this particular patient, what will be the complication? If at all you don't treat this particular patient, what will happen? So in case of achalasia cardia, what will happen? The patient might land up into the carcinoma of the esophagus, the squamous cell carcinoma. What part? Okay, so the middle part. Okay, all these things. So please understand, this is how you should correlate. And finally, about the treatment. Whenever you talk about the treatment, you should be able to tell what are the treatment options available, what is the best treatment option, and depending on the clinical scenario of the patient, what is the treatment which you will give to the patient. For example, if the patient is fit for the surgery, if the patient is not fit for the surgery, what kind of treatments you will give. Okay, so if at all you are able to divide all the topics in general surgery and remember the relevant things under these subheadings, you are good to go. even if you forget what is the kind of a syndrome associated with this, even if you forget what is the chromosome number associated with this, see, understand the chromosome numbers which are very very important, for example von Hippel-Lindau disease 3p, these things you should not forget. But if at all you forget some rare chromosome, if at all you forget some rare syndrome, that's completely fine. It's fine, it's nothing bad about it. Even if you forget about the percentages, okay, so these number percentages of patients will develop achalasia from of achalasia cardia will develop carcinoma. So if you forget those percentages, it's completely fine, nobody expects it from you, okay. And there is no one single percentage, multiple studies give you different percentages. So what exactly you need to focus on in general surgery is these particular points. If you are able to master these particular subtopics, you are good to go. You don't need to remember much. So this is a kind of a correlated kind of a thing, and if you are able to do this, you will be able to conquer general surgery, okay. I hope I made my point, okay. Right, so I'll just take up a couple of questions more. Right, so hi Arshit, good to have you. Right, right. Right, moving on. So this is a point which I was trying to make you. Then another thing is try to correlate the similar sounding diseases and try to correlate the similar pathogenesis. So if at all you have a look at achalasia cardia, congenital hypertrophic pulmonary stenosis and Hirschsprung disease, I ask you, is there any correlation between these? Okay, so do you think is there any correlation between these? Yes, there is a definitive correlation between these. See, understand the disease pathogenesis is completely different, the diseases are completely different, but as far as the NEET PG is concerned, you can definitely correlate between these diseases. What exactly is happening in the achalasia cardia? This food is not able to enter into the stomach. In the congenital hypertrophic pulmonary stenosis, the food is not able to escape from the stomach into the intestine, and the Hirschsprung disease, the food is not able to go from the anal canal or from the rectum into the external atmosphere, okay. So these is the particular things which are happening. So if you just try to correlate in achalasia cardia, what is the age-old treatment which we do? We do a Heller's cardiomyotomy. In the congenital hypertrophic pulmonary stenosis, what is the treatment which we go for? We go for Ramsted's pyloromyotomy. Okay, and what about this Hirschsprung disease? If at all it is a short segment disease, what you go for? You go for a myectomy. So everywhere you are taking out the muscle layer, okay. So if at all you correlate these particular things, you will understand the disease pathogenesis of all the three, and they will basically stick to your mind for a longer period of time. So I hope you understood what I was trying to convey is concentrate on understanding of disease pathogenesis and concentrate on how do you actually manage a particular patient. If at all you do that, you will be good. There is absolutely nothing which will go wrong with you, okay. So yeah, this is the point which I was trying to make. Another important thing is decide one book and stick with it. So it really doesn't matter which book you read, around 85, 90, 95% of the things are absolutely the same. Find a book which resonates with you and you stick with it, okay. So yes, that is again an important thing, and all the additional information at one place. So for example, if you find some really good information, so let's say if you're reading some particular notes or you're reading some particular book, and if at all you're finding some Q bank or anything, if you find that that is relevant for your exams, please add on to that particular thing, because once you start your revision, you will have only that one particular source. Rather than having a look at 5 or 6 sources, you should have a look at only one particular source, because that will save time and that will increase your kind of revision frequency, okay. So do that. Right, so these are the basic things which you need to follow, and I was just trying to concentrate. This is something very very important, because I've seen students, they kind of start mugging up things, and they even start to mug up all the percentages and all the rare syndromes, all the rare chromosomes. Don't fall into that trap. What you need to understand is these particular things, but the crux of the matter is you need to understand this for all the subtopics of general surgery, right from the basics of the general surgery till the cardiothoracic system. If at all I say any particular disease, you should be able to compartmentalize that particular disease into these 5 subtopics, and you should be able to fill them, okay. So I hope you understood. I hope I made my point. Right, moving on to the next thing. What is the importance of giving a grand test? Please understand, there is a lot importance of giving a grand test. Everybody knows that, but many few students actually give that. So there are 2 types of tests. One is the subject-wise test, one is the grand test. Yes, subject-wise tests are important, but at the same time, grand tests are very, very important. So how do the grand tests help? They help you in retrieving the information from your brain. For example, you have read general surgery in the month of January. Okay, so if you have read general surgery in the month of January, and you are trying to solve a grand test in the, let's say, month of May. Okay, so you have not revised general surgery in the recent past, but if at all you solve a grand test in month of May, your mind will undergo the drill of retrieving the information from its memory. So this is important because if at all you sincerely and dedicatedly give grand tests, what it will help in? It will help in reducing the silly mistakes. So I'm sure you must have talked a lot about this, that whenever you come out of your exam, you tell that I've committed so many silly mistakes, and if I wouldn't have committed those silly mistakes, I would have got a really, really good rank. I'm sure many of you will resonate with this. So what exactly are these silly mistakes? These are just a kind of a indicator that you're not able to retrieve those informations very nicely from your brain, because obviously you have read that particular topic, okay, you have gone through that particular topic, you have read that particular question, but you're not able to retrieve it from your brain. So how it can be increased? With the help of a grand test. And how you should solve a grand test. For example, if you are giving a grand test of, let's say, 200 MC, 300 MCQs or whatever, so try to give a grand test in the morning, like let's say 9 to 10 or 9 to 11 or 9 to 12 or whatever. And once you have completed with the grand test, just take up a couple of minutes, like half an hour off or something, and dedicate the next 6 to 8 hours in order to dissect that particular grand test. What exactly are you having a look at it? You're not trying to look what are the questions you did correct. You're trying to look what are the questions you did wrong, and what was the thought process in your mind for doing those particular questions wrong. And simultaneously, you have to revise all the 300 topics. For example, if there is a grand test of 300 questions, it actually means that it is a grand test of 300 topics. Okay, so you don't have to just read that particular question. Whenever you dissect a grand test, you need to revise those 300 topics. So basically, devote that particular day for the grand test. Okay, so you can keep a couple of days in a month for a grand test. The best way to solve is solve the grand test in the morning and then devote 6 to 8 hours in dissecting the grand test, in which you basically read those 300 topics in a good manner, right? So, and when should you start giving a grand test? See, understand, don't wait till completing all the 20 subjects, because this is the reason why many students are not able to give all the grand tests. So once you have reached to a mark of, let's say, 6, 7, 8 subjects or something, you should start giving a grand test. What will happen at the max? You might not score good, but over a period of time, as you read more and more subjects, your progress will happen and you will be able to self introspect yourself. Okay, so please don't wait for a long period of time for giving up grand tests. Don't say that I will complete my 20 subjects and then I'll give all the grand tests. This is not how it works. What you're trying to do is you're trying to make your mind undergo the practice drill of giving an exam. So please do that. Start giving up a grand test as soon as possible. Okay, so I hope you understood it, right? So this is the point which I wanted to make about the grand tests and all these things. Now, how to manage time. So this is again important. So please understand, you have to set up a routine. It really doesn't matter you read in the morning or you read in the night. That's completely fine. Every person is different, but you should have a routine. It's not like you read for a 1 hour today and then tomorrow you read for 10 hours and then again the third day you don't read or something like that. It shouldn't happen. You have to set up a routine. So I completely get it that if at all you're working in a hospital or something, if you're an intern or something, your routine might change every month. That's completely fine. But at least for that one particular month, at least the broad routine should be set up. Okay, so at least a broad routine should be set up. So please set up a routine, it helps. Now another important thing is the Pomodoro technique. So what is this Pomodoro technique? Now I have seen so many students, they sit with the books for such a long period of time and they don't actually read. What happens is after some time, their mind basically wanders here and there. There are many things which comes in your mind in your NEET PG preparation. It's a tough period. You think about, oh, what if I cannot get selected? What if I don't get up a rank? What if I get a really, really good rank? What if, where will be my friend? And all those things, all kinds of thoughts come in your mind. So a method in order to get rid of all these thoughts and everything, and also the social media. Obviously many students are sitting there and every 5 minutes they check their phone for the WhatsApp or Instagram or Facebook or whatever. It's nothing voluntarily, they're just saying that I'm just flipping through if any message has come or something like that. But please understand, if you actually have a look at it, a lot of your time in a particular day goes into all these things. So in order to get rid of all these things, you have to follow something which is called as the Pomodoro method. Now what is this Pomodoro method? Okay, so ideal Pomodoro method, which the Pomodoro actually gave, it was a time gap of like 25 to 5. So what the method says that you read for 25 minutes and then you're allowed to take up a 5 minutes break. But for NEET PG, 25 minutes is kind of not very enough. So what I advise is you read for 50 minutes and then you are allowed to take up a 10 minutes break. So how many sessions of this you need to do? If at all you are able to pull through 6 to 8 sessions of this particular technique every day, but every day, that is a crux. Okay, you really don't need to read 12 hours, 14 hours a day. If at all you are able to read even for 6 to 8 hours every day with this particular technique, you read for 50 minutes, you don't touch anything, you make sure that your mind doesn't wander here and there, and you actually read this particular thing, and then you are able to forget about the studies for the 10 minutes and you are allowed to do whatever you want. So if at all you follow this for 6 to 8 sessions every day, your chances of getting successful in the coming exams will be very drastically increased. Okay, so it's a myth that you have to read for 12 hours or 14 hours or something. You don't have to read that. Nobody can read that. Okay, so definitely if at all the exams are just very nearby, just before the exams, just 1 week or 2 weeks before the exams, you have to read more time, but for a prolonged period of time, let's say for a period of 6 months or 12 months or something like that. So it's not humanly possible to read 12 to 14 hours every day. It's not possible. What is possible is you can pull out this 6 to 8 hours every day with this particular technique, 50 minutes of reading, 10 minutes of break. If at all you do that, that is very good. And be accountable to yourself. At least, be accountable to yourself. Ask yourself, did you truly study? Did you truly put in your 100% in this particular day? Did you lay this particular brick the best way you could have done? If at all the answer is no, try to self-introspect, try to do the necessary corrections, whatever is possible, and then you will definitely improve on your results and everything. So please be accountable to yourself. In this 10 minutes, also devote a couple of minutes in order to review. Did you put in 100% in the previous 50 minutes? Okay. Right, so you can do that. So this is how you can manage your time. So in this particular session, that is a part 1, I basically talked about how you should read and how you should do. In the next particular session, I will be talking about the importance of revision. Okay, so importance of revision is something which I'll be focusing on part 2. Okay, so I hope this helped you a bit. If you have any doubts, please do ask me. I'll be more than happy to share my thoughts and views over it. So please understand, guys, you have to be sincere. That's completely fine, but you don't have to lose your mind if at all you follow these basic tricks. So in this particular video, I've basically talked to you about how you should read general surgery, and at the same time I've also told you about how is one of the ways you can manage your time. So you do the best what resonates with you. Don't do this if at all somebody else is saying or something like that, but try to adopt it. If at all it resonates with you, please follow it. Thank you so much for joining with me today. It was indeed a pleasure joining with you guys. If you have any doubts, please do ask me. I'll be more than happy to give my opinion. If at all you have any doubts, I'll be more than happy. So please follow us on Unacademy. My link of the profile will be in the description box. You can have a look at it. Just follow me there. And these are the basically courses which I have launched on kind of Unacademy. There's a detailed course for the urology, which has basically ended, and then there's a detailed course on hepatobiliary system, and I'm also coming up with the foundation course, and I'm in the process of launching the important MCQ based courses on the general surgery and GIT and the cardiothoracic system and vascular system. So all these things are in the pipeline. They will be launched very soon. So if at all you want to check any of the plus courses, please go on my page and you can have a look at it. If at all you want to take up a subscription on Academy, so right, a 6-month subscription at this moment is at 18K and the 12-month subscription is at 22.5K. What exactly will you have access with this particular subscriptions? You will have access to all the courses, all the videos uploaded by any educator on the platform. At the same time, you will have access to the test series and the Q bank and the structured notes on the Unacademy platform. So you will have access to unlimited access to all the things available on the platform. So please do go and have a check of it. The Q bank and structured notes are not yet live. They will be live very soon in 1 month or so. But yes, all the videos and the foundation course, which is the basic course for the NEET 2021, it has already been live. At the same time, there is an integrated course which is coming up for the NIMANS exam, so you can have a look at that too. If at all you want to join any of these, you can use this promo code, that is drpawan-yt, so like #YT. So if at all you use this, you will get 10% discount, and if at all you do this, you will get a 6-month subscription in 18K and 12-month subscription in 22.5K, right? So right. So Surya is asking, from where do we get the recent updated topics? Please understand, Surya, the recent updated topics are important, no doubt about it. But yeah, from where do you get that? So basically, you can have a look at the previous 5 years MCQ questions. So those are basically the recall based questions. So you can have a look at that, and those are basically the important topics for the AIMS and PGI. But please understand, if at all you are really aiming at the mid-year exams and you want to get a really good rank and you want to get up a really good seat, so just focusing on the high yield topics or just focusing on the previous 5 years topics, it won't help much. So what you have to go for is, you have to go for a holistic revision of a particular subject. So for the AIMS and PGI, your plan should be, you should finish your first reading by 30th of March, and then in the month of April you have to revise 2 times, and then you will have to go and attempt your exam. I assume that your AIMS is on 3rd May. So yes, you don't have much time. Till the 30th of March, you have to complete your first reading. In that, you have to read all the 20 subjects, and then in the month of April, you have to revise it 2 times. Let's say the first revision in first 20 days and the second revision in the next 10 or 13 days or whatever you have. So this is how you should go about. If at all you go for the holistic revision of a particular subject, this is the way to get up a really good rank. Definitely you should give a more importance to the topics which are asked in the last 5 years, but don't become fanatic about it, because there is no guarantee that those will be asked. Okay, so right, rather than that, go for the holistic revision of a particular subject. That will help you in a better manner. Right, so I hope I made my point. Did you get your answer, Surya? Right, thank you so much for joining with me, guys, and have a great day. Right, so thank you so much for joining with me. So this was our part 1, and in the part 2, which will be coming very soon, in that I will be talking about the importance of revision and how exactly you should revise. In that I'll be talking about the 2 methods, that is the active recall and the spaced repetition. So I'll be talking about it. Thank you so much for joining with me today. Right, have a great day. Bye.